So hi everyone, and welcome to another episode of Aila Health's Patient Spotlight series. I am here today with Molly Dunham-Friel, and she was diagnosed with ulcerative colitis in 2012 and irritable bowel syndrome in 2013. And since then, she shares her story and advocates with chronic illness and Crohn's and the Crohn's and Colitis Foundation as a support group leader. She advocates for better care and since then has created her own blog, Better Bellies by Molly. And now she's on a mission to make sure that other IBD and IBS warriors don't feel as alone as she once did. So we're really glad to have you here with us today, Molly, and just to hear a bit more about your story. And maybe that's a great place to start. Can you just give us a little snippet of what that journey has been like for you over the years?
Sure. Well, thank you so much for having me. I'm thrilled to be able to share my story. So like Shannon mentioned, I was diagnosed with ulcerative colitis in 2012 and shortly after irritable bowel syndrome, commonly referred to as IBS. So when I first was diagnosed with ulcerative colitis, I didn't even know what it was. I'd actually never heard of it before. I was familiar with Crohn's because I've heard about people and knew a couple of people that had Crohn's disease, but I had truly never heard of the term ulcerative colitis. So it was like a completely new thing for me. I was 23 years old. I had just graduated college and moved to Atlanta. So I was literally living here by myself. I had no social connections. I literally knew zero people. And so it was just kind of rocked my world and turned it upside down to be, to all of a sudden be out on my own, but then also to get sick. And then to find out that this illness that I had, wasn't curable and that I would have it forever. It was a lot to swallow. And it sort of took me a long time to feel comfortable talking about it. And finally, I just didn't want to live alone with this disease anymore. And I kind of got the courage up to start sharing my journey and talking about the uncomfortable things that comes along with IBS and IBD. And so that's why in 2018, many years later, I really started to get involved with the Crohn's and Colitis Foundation. I began attending support groups. I started moderating support groups. I continue to volunteer and do that work, but then I also created Better Bellies by Molly, which is really my goal is to use it for advocacy, education, and awareness, but really support of the IBD community and to build and grow the community to be stronger together.
And I love that so much. And we'll include a link to your blog at the bottom of this as well for those who are interested in taking a look at what resources are there. And so I'm just curious, what, you've been through this personal journey with dealing, with this chronic illness. And as you're coming into this place of, also helping others in that space, what do you find that people are looking for most when they are maybe at the beginning stage of that diagnosis journey and, feeling like, oh my gosh, what's next? What do I even do?
Sure. So I think the first thing people are looking for is information. They are, they're given a diagnosis, or maybe they're working towards that diagnosis. Maybe it's not there yet. And they just don't have the information because the patient education isn't always strong. There isn't always a lot of time, the way that the healthcare system is set up, at least here in the US, for providers to sit down and spend an hour explaining what this disease is and what the rest of your life is going to look like. So I think most people are just trying to wrap their heads around it, get the information of like, what is this disease? What does this mean? What are these drugs that I've been prescribed? Like, what are these tests? What are these words that my provider is saying? And I think so, looking for clarity, looking for information, looking for education, but then also for support. I think not feeling alone. I felt alone and literally was the only person that I knew with ulcerative colitis and really Crohn's in terms of like people who I knew in person for a long time. And it feels really isolating. It feels like you are literally the only person dealing with these embarrassing things that you don't feel comfortable talking about to just anybody. And so knowing you're not alone and having someone else be like, hey, I'm right here with you. You can send me a direct message. You can ping me. You can look at my Instagram. You can look at my blog. Like, you're in good company. There's a foundation here to support you. There's people, there's warriors we've got you, we're in this together, I think is the other thing. So support and education and information, I think when you're first diagnosed is key.
Yeah, that's so true. And feeling like you're not the only person in the world who's going through this, you know, and having that like common humanity piece of like, okay, yeah, my condition or my experience is unique, but I'm certainly not the only person in this planet, you know, dealing with this. And you know, so that connection and that support. And you know, something that you've mentioned a couple of times here is just kind of knowing that that place of, you know, feeling like maybe embarrassed of like what to share about this condition and with who. So, you know, just wondering how have you found that balance, or like how do you evaluate when it's right to share aspects of your condition with others?
So that one's pretty challenging. So I have slowly over time shared more and more information. Some of the things that are really hard to share about, I felt called to share because I knew in the IBD space, not a lot of people were talking about them. And that said to me, I need to talk about this. Like I need to be the one to, you know, speak out about how to use an enema and that you have to use them. And, you know, it's okay to have to use these and you're not alone. Actually, there's a lot of people that use them. We just don't advertise it. Also like bloody poop, like having blood in your poop or just bleeding, or not even having regular poop, and just all the things that come along with that psychologically, mentally, physically, and like the traumas that we sometimes experience, whether they're little traumas or big traumas, as a chronic illness patient, and speaking out about those things. There are things that I've experienced for years and years. And I think it just, I kind of just listen to my intuition and feel like a calling to speak up about it. And I kind of sometimes I put things on the back burner, and then I just kind of eventually get the courage to say, you know, I'm just going to go ahead and do it. And there's no like perfect recipe for that, to answer your question specifically, but it's just more like a calling, a feeling like, okay, I'm ready to just put it out there. And it's just kind of like a feeling / overcoming the fear and being like, you know, if people are going to look at me different or think of me differently or not respect me because of this, that's really not about me. That's about them. So just trying to keep that perspective and trying to think about and focus on how I could help other people and putting that in the forefront, which is, okay, you know, if I share this, it's going to help somebody else. And that matters more than me being a little embarrassed.
I love that. And so it sounds like, you know, there's certainly aspects of this that not a lot of people are talking about, but yet it's a very real part of the experience and the condition. Yes. So, you know, so I'm wondering, is there something that you wish that other people knew about this illness, or there's some misconception that you would like to address?
Yeah, I think there's a lot of misconceptions simply in the space of invisible illnesses in general. I think, which is that an illness only exists when you can see it. Someone's only sick when they look sick, feel sick, act sick. It's not true. That's not the case at all. There's actually a ton of invisible illnesses. IBD and IBS are just two of them. I mean, and Crohn's and Colitis are their own diseases. They're all, for the most part, invisible illnesses. And there's so many. Mental health, a lot of times, is very invisible, which comes in and is right underneath like the IBD and IBS connection. So I think like really just making IBD visible, making sure people know what it's like to go through it, and to grow more compassion in the general population and public, to just be more compassionate towards all people, but especially people who are going through something in an invisible illness, and keeping in mind that you don't know who's going through what, and just kind of leading with compassion instead of, I guess, maybe disrespect or just assuming. Just, you know, don't assume, be compassionate towards yourself, but towards others, and try to put yourself in someone else's shoes. And if you are interested, or you know someone with IBD or IBS, learn about it. Really learn about it from patients, learn the patient perspective. I think there's something really powerful about that. And I love to see more and more companies and all types of groups really taking that patient perspective and bringing it to the table. And I'm really thrilled anytime I get pulled in to be that patient perspective.
Yeah, certainly one of the things we prioritize here with Aila Health is bringing in that patient perspective and creating a community of chronic illness warriors in, in the space of IBD, in the space of, these other branches of an invisible illness. Like you said, there's, it's not just one, there's not even a handful, there's so many, unfortunately. So I love that. I love that piece about, bringing in kindness and compassion, and what wonderful words of wisdom. And in our remaining few minutes here, is there any other words of wisdom that you would like to impart on behalf of
Sure. So if I was speaking to someone recently diagnosed with IBD or IBS, or just any other chronic illness warrior out there, I really just have to say, like, you are not alone. Even when you feel alone, even at your lowest, someone else is going through something similar. That doesn't make it better or go away or less painful, but just know that you have a community of people rooting for you. You can reach out to them whenever. I'm always happy to chat at Better Bellies by Molly. And there's so many other patient leaders out there willing to help you. So really just keep that in your heart wherever you go in your journey. Also know that you need to advocate for yourself, and that can be hard. And when you're unable to advocate for yourself, building a support group, building a support team, whether it's one person or 5 people, whether it's your healthcare providers, your family or friends, it doesn't matter who, just knowing that you have that support. And then also just speaking up for yourself, knowing that you are living in this body and this is your chronic illness journey, and you have all the power to go to the doctors that you see fit, seek the treatment that you see fit, and have shared decision making. And then, just be kind and give yourself grace, because this is tough and it is a journey, but we're all in this together.
So beautiful. Thank you so much, Molly. And again, that blog will be linked below for those who are interested. I'm sure there's a ton of great information there on these topics that you're just speaking to here in these short minutes we're together. But thanks again so much for being here with us and sharing your insight.
Thank you so much. It was so great to be here.